Thank you for taking the time to check out this video. We're going to be talking about what to expect after your superior cluneal nerve surgery. Okay, so we spent a lot of time in the office talking about why we're doing the surgery and the relevant anatomy. We're going to take a few minutes here in this video to go over what to expect after surgery and what you should and should not do. These are your post-operative instructions. Now, a lot of people will wonder, why are we doing this? I've already heard this information in the in the recovery room, and I also got a lot of this information in the office. A lot of people have asked me, actually, how come we didn't do something like this earlier? Why don't we routinely do something like this? Because very often what happens is patients will come in for surgery and they get overwhelmed with a whole bunch of information after the surgery, and it's hard for them to keep all of it straight. And so I thought it would be useful for you to have this video as a reference, so you can go back and watch it as many times as you need to or as you want to in order to know what it is to expect and what to do. It's also a great resource for your family members to be able to watch if they have questions about how they can help you after surgery, or if they have questions about what to expect after surgery. So please feel free to watch this video as many times as you need to and share it with your family members as needed in order to be able to take best care of yourself after surgery. Okay, so in addition to this video, you will have received a set of discharge instructions that look something like this, okay, on the fluorescent sheet of paper. You will also have received another set of discharge instructions that look something like this, okay? And these instructions all have the same information as what I'm going to tell you here in this video. The reason we did it in these three different formats is so that you have multiple tools available to you to be able to know what to do and what to expect, okay? Some people find it easier to watch a video and hear me talk about what they should do and what they should expect. Other people find it easier to read the instructions, and other people find it easier to see it in a graph format. And so we've provided all three of those for your use. You should have received all of this information through email, and you should also have received the discharge instructions in paper. So feel free to take a look at those as often as you need to. They should all say the same thing, okay? So let's start with what you should expect after surgery. So on your wound, we've used something called Dermabond PRINEO. It's a new way to close wounds that doesn't involve sutures or staples that need to be removed. You'll notice that there's a light purple mesh that looks like it's glued to your skin. That's because you have a light purple mesh that's glued to your skin, okay? It's important not to remove that because we put that there instead of stitches on the outside. So if you remove it prematurely, there's a good chance that your wound is going to pop open. So please leave it in place. You will notice that over the next 4 weeks, which is how long we'd like it to stay on there, the edges are going to start to peel up. When that happens, just trim off the stuff that's loose and leave the rest in place. That will ensure that you get the best results possible. We want to make this as easy a recovery process for you as we can. It's also important to remember that you can use soap and water on the mesh, but you shouldn't use anything else like alcohol or hydrogen peroxide or any ointments like Neosporin or anything else like that, because those things will actually break down the glue that helps hold that mesh in place, and it will lead to other problems with your wound. So we're trying to get you the best results possible and minimize the chance of you getting a wound infection or you getting a problem with your wound healing. If you have any questions or concerns, please reach out. So let's go over activity restrictions. Number one, after undergoing the surgery, it is important, really, really important, that you not go swimming and not take a bath. It is okay to take a shower, okay, but immersing the wound in water is a bad idea. It'll significantly increase the risk of wound breakdown, in other words, the wound opening up, which we don't want. It'll also significantly increase the risk of an infection, and that's something we're also trying to avoid. So for the first 4 weeks after surgery, it is okay to get the incision wet in the shower, but it is not okay to take a bath or to go swimming. Okay, that's very, very important. If you have questions or concerns about that, send me a text message or give me a call. You'll notice that on the bottom of this discharge instruction sheet is my cell phone number, okay? All of my post-operative patients get my cell phone number, and so just give us a call if you have a concern. Send me a text message, give me a call. If what you've read and what you've seen and what you're hearing me say now doesn't make sense, that's available for you as a resource as well, okay? So you can get the incision wet in the shower, but please don't go swimming and don't take a bath until you've been cleared by me or Steve to do so, okay? Other activity restrictions. For the first 2 weeks after surgery, it is important that you not lift anything heavier than a gallon of milk, okay? For the first 2 weeks after surgery, don't lift anything heavier than a gallon of milk. The reason for that is that we don't want the wound popping open, and we also don't want you causing a bunch of bleeding that could occur if you overdo it, okay? So for the first 2 weeks, don't lift anything heavier than a gallon of milk. The third week after surgery, you can lift up to 20 pounds, and the fourth week after surgery, you can lift up to 40 pounds. After 4 weeks, assuming you haven't had any wound healing problems, there are no longer any activity restrictions, okay? But please try to stick with those activity restrictions in order for you to get the best results, okay? So that you have fewer problems and decrease the risk of complications, and so that you get a great result, because obviously we're going through the trouble of undergoing surgery. We want you to get the best results possible, okay? A couple other things. You'll notice that you have recommendations for a number of different medicines to help you with pain after surgery, okay? And those medicines have a particular way of being taken, and there are particular reasons for you taking them, okay? So I want to go over each of those right now. One of the medicines we've prescribed for you for your recovery is Tylenol. Now, you're thinking to yourself, well, you know, I use that for headaches, and how is that going to help me with pain? When it's used in combination with non-steroidal anti-inflammatory drugs like ibuprofen or naproxen or some of the other ones you might get, it actually is more effective than narcotics at controlling surgical pain. It is very important, however, that you take that Tylenol every 8 hours. And if you've been prescribed ibuprofen, then take it at the same time as the ibuprofen. Don't take it separately from the ibuprofen. Take those two medicines together. It'll be a lot more effective that way. Take 1,000 milligrams every 8 hours, and take it with your ibuprofen if you've been given a prescription for ibuprofen. You'll find that you'll do a whole lot better after surgery, and you'll recover much more quickly. Some patients have questions or they're nervous about taking Tylenol, and I understand that. So if you have questions about it, please feel free to reach out. Don't hesitate to contact me before you decide to make any changes to the medicines that we've prescribed for you. The combination of medicines that we've prescribed is the most effective way to get you the best short-term and long-term results. We can modify these combinations, these different medicines, but we should talk about that before you do that. So please make sure, if you have any concerns or you feel like you don't like the side effects and you want to do something different, just reach out. Let me know, and we can talk about it together. In addition to that, I want you to take some ibuprofen. That'll be 800 milligrams every 8 hours. Now, of course, some of you are thinking to yourselves right now, okay, well, that means I have to take the ibuprofen at noon, I got to take the Tylenol at 4, and then the ibuprofen at 8. The reason we chose the 8-hour Tylenol is to make it easier for you to keep track of your medicines. Tylenol and ibuprofen do not work the same way, and so it's okay to take both of them together. And we purposely chose this in order to make it easier for you to keep track of it. So let's say, for instance, you're going to take your Tylenol at 8 a.m., then take your ibuprofen at 8 a.m. also, okay? And then obviously 8 hours later, you would take both of them together. And so that would be, let's say, at 4 p.m., you'll take both of them together. So take both of them together. That'll help you to be able to sleep through the night without having to wake up in the middle of the night to take the medicine for pain. Both of these medicines, it's important to take around the clock for the first 4 weeks after surgery, whether you have pain or not, okay? One of the reasons for that is that if you keep the pain under good control, then the likelihood that you'll need the oxycodone, which we're going to talk about in a minute, is significantly lower, okay? It's a lot easier to stay ahead of the pain than it is to try to catch up on it. That's number one. Number two, there are some studies which have suggested that in patients who undergo surgery, if you have better pain control early on, the likelihood of having chronic nerve-related pain a year later is significantly lower. And so we're trying to avoid that also. So it's not just to make you comfortable now. We're trying to get you a better result later on down the road. So it's important to take the ibuprofen and the Tylenol as it's directed on your discharge instruction sheet and as we're talking about right now. So let's talk about gabapentin. That's the next medicine that you're going to take, okay? Now, some of you will have been taking gabapentin before surgery already, and some of you will have been taking Lyrica before surgery already. If you were taking Lyrica, then ignore what we're going to say about the gabapentin. If you were taking gabapentin before surgery already, then these instructions might apply to you depending on the dose that you were taking. If you were taking a relatively low dose, we're going to increase that dose. We're going to talk about that in a second. If you were already taking a high dose, then you're going to stay on that. You'll notice the details for that in your written discharge instructions, so pay particular attention to that, please. Okay? Now, for those of you that have never been on gabapentin, or maybe you were on it in the past and now you're being asked to take it again, you should have taken a dose of gabapentin, a big dose, the night before surgery. It is important to take the gabapentin every 8 hours for the first 2 weeks after surgery. Okay? The ibuprofen you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not. Okay? The Tylenol you're going to take every 8 hours for 4 weeks after surgery, whether you have pain or not. The gabapentin you're going to take every 8 hours for 2 weeks after surgery, whether you have pain or not. Again, the reason for this is to decrease the risk of chronic nerve-related pain later on down the road, in addition to helping you with your immediate pain after surgery. Okay, so the gabapentin you're going to take for 2 weeks after surgery. The ibuprofen and the Tylenol you're going to take for 4 weeks after surgery. All three of those, regardless of whether or not you have pain. Okay, the next medicine is a little bit unusual, or at least it may seem a little bit unusual at first, and it's high-dose vitamin C, 1,500 milligrams that you're going to take, okay, every day for the first month, for 4 weeks after surgery, okay? The vitamin C isn't a nutritional supplement in this case. This isn't because we have some concern about whether or not you're getting enough vitamin C or whether or not you have some kind of nutritional deficiency. The reason for the vitamin C is that in some studies it's been shown that using high-dose vitamin C after certain types of nerve-related procedures, it can decrease the risk of what's called complex regional pain syndrome, which is a nerve-related pain problem, which is chronic pain that typically won't show up immediately after surgery. There have been some studies which have suggested that taking the high-dose vitamin C will help with chronic nerve-related pain a year after surgery. Okay, it'll prevent you from having chronic nerve-related pain a year later. Okay, so it is important to take it now. You're not going to notice a difference now in terms of how it makes you feel. It will make a difference later on down the road, and so that's the reason for taking that. Okay, the only other medicine that's on the list, I know it seems like it's been a long laundry list of medicine. The other medicine that's on the list that's important for you to take is minocycline. Okay, now for those of you that are allergic to tetracycline or allergic to minocycline, you'll have a prescription for Bactrim instead. But either way, it's an antibiotic that you take twice a day, every 12 hours, and you'll notice again on your discharge instructions it'll say exactly which medicine and for how long. Okay, so you're going to take that every 12 hours for 10 days. Please take it until it's all gone. We should never hear about leftover antibiotics. Leftover and antibiotics don't go in the same sentence together, okay? So take those until they're gone. That's in order to decrease the risk of a wound infection. If you end up with a wound infection, there is a higher risk of having chronic nerve-related pain later on down the road, not to mention having a more prominent scar. So please keep that in mind. Try to avoid the risk of wound infection. Take the antibiotics until they're gone. Okay. The last thing I want to mention has to do with ice and heat. Okay. Now you may have gotten lots of differing advice from different people about ice and heat. Okay. When it comes to this particular surgery, please pay attention to what I'm about to mention to you now. Okay. It's going to be different, most likely, than what you've heard from other doctors and from your physical therapist and anybody else as it pertains to ice and heat. And I'm going to go over why we choose to do things a little bit differently. Okay, so for the first 48 hours after surgery, you can use ice. Okay, and a lot of people find that it's helpful in terms of managing discomfort. So use the ice. Don't use it for more than 20 minutes every hour. Okay, but you can use it every hour, but not more than 20 minutes every hour. If you do it more often than that, you do run the risk of developing frostbite. Okay, and so pay particular attention to that. 20 minutes at the most every hour. Okay, that's for the first 48 hours. After 48 hours, do not apply ice any longer. Okay, you can use heat again for up to 20 minutes every hour. And the reason for that is that the ice is helpful initially after surgery because it decreases swelling by decreasing blood flow to that area. Okay, and it also helps with pain for some patients because it numbs up the nerves, kind of like just before frostbite, and that's the reason we don't want to overdo it, because you don't want to end up with frostbite. But the reason we switch to heat after 48 hours, which might be contrary to some of the things you've heard from other people, is that the heat causes the blood vessels to open up, okay, what we call vasodilation. And when the blood vessels open up, it increases blood flow to that area. It increases oxygenation. It increases the amount of nutrients that get to that area. And as a plastic surgeon, one of my highest priorities is making sure that that wound heals as well as possible and as quickly as possible. And the heat and the nutrition and the oxygenation and the improved blood flow ensure that that wound is going to heal as well as possible. Okay, by using ice, what you're doing is you're decreasing blood flow to the area. You're slowing down the healing process. Okay, now I'm not telling you to not follow your other doctor's directions if you've gotten instructions about some other kind of surgery and what they're telling you as far as ice goes. Okay, whatever your other doctor told you about your other surgery, follow those instructions. But when it comes to a surgery that I have done for you, please follow these instructions. Ice for 48 hours, again, no more than 20 minutes every hour, and then after the first 48 hours, switch to heat. Do not apply ice any longer after the first 48 hours, okay? Lastly, if you have any concerns or questions that were not covered in this video or that weren't covered in the written discharge instructions, or there's something that you're confused about and you don't understand, that's a good opportunity for you to call our office or email us or to send me a text message or call me. Again, you have my cell phone number. Every single one of my post-operative patients gets my cell phone number, so this is the time when you want to text or call if everything we've just gone over is still confusing or doesn't answer a question that you have. Okay, so don't be shy. Let me know if you have any other concerns or questions. And most importantly, please be careful and take care. We look forward to seeing you soon.